What is spinal stenosis and how can I treat it?
Welcome back, Dr. Edward Rubin here, talking all things pain management. Today we're going to hit the topic of spinal stenosis, and more specifically things that can be done by an interventional pain specialist for spinal stenosis. Now, how do you know if you have spinal stenosis? The short answer is an MRI is really the gold standard to see what's going on in the spine. But some of the classic signs are pain with prolonged standing, pain with walking. And what you'll often ask patients is, when you're at the store, do you find yourself leaning on the shopping cart and walking around? It's your body's way of trying to decompress and open up the spinal canal. We call that the shopping cart sign. So here's my quick algorithm on how we tackle spinal stenosis as an interventional specialist in pain management. First thing I'll try is a transforaminal epidural injection, a targeted cortisone shot at the level of stenosis, and we usually use the transforaminal approach to start, where we go along the nerve and spread the medication in. That uses a smaller volume, so it allows us to target at the level of the stenosis with less discomfort and less pain. Let's say we did a transforaminal and it's not working. I can change approach and do an interlaminar epidural steroid injection, so that would be option number 2. Usually I'm going to go a level above or below the stenosis for patient safety and comfort, because injecting midline at the level of stenosis could cause extra discomfort. Now let's assume you've done those 2 options and you're still not feeling enough relief. Well, then you're at a crossroads. Either you're going to consider surgical options at that point, or a minimally invasive surgical option, which is something your interventional pain specialist may offer. In my case, I do the mild procedure, minimally invasive lumbar decompression. Through a tube about the size of a pencil, we can scrape out the back of the canal and make more room inside the spinal canal, thus decompressing the stenosis. Lastly, we have the interspinous spacers. And what those do is open up the space in the spinal canal permanently by putting a metal device in there, either a fixator or a spacer. There's a number of them on the market, but those can be quite effective. If you feel that it's severe stenosis, you may opt for a surgical option at any point along that pathway. So surgery is always an off-ramp along any of those decision trees. For more details on these specific procedures, go to my channel and you can watch the at-length videos. Hope this was helpful.